If they have any or all of the following: fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet (1.8 meters) or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronaviruses are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Hi everyone, I'm Dr. Dwayne Archibald, Head of Emergency Room at Joseph and France Hospital. Novel coronavirus has been topic of conversation globally and of course in St. Kitts and Nevis. Basically, the word novel in coronavirus identifies that this is something new to the human being. In preparation of COVID-19 in St. Kitts and Nevis, we have to be able to identify the symptoms. These symptoms may include fever for a prolonged period of time, coughing for a prolonged period of time, shortness of breath, or any respiratory type symptoms. In addition, for prevention, we should avoid holding hands, shaking hands, sharing forks, knives, spoons, and even cups. So consider avoiding touching one's face, nose, mouth, eyes. So to avoid self-contamination, that is touching the face, we are advised to use alcohol-based hand sanitizers. Now, these alcohol-based hand sanitizers should have at least 60 to 70% alcohol in it. We should also consider washing our hands thoroughly when handling babies before and after, also in the case of the sick and the elderly. So when I speak of sick people, I refer to elderly over 60, I refer to people with hypertension, diabetes, kidney compromise or kidney failure. Hand hygiene is important in cooking. We should
Good day and welcome to the National Emergency Operations Center COVID-19 daily briefing for April 12, 2020. Thank you very much for joining us on this Resurrection Sunday for our daily briefing. Today culminates Holy Week with Easter Sunday or Resurrection Sunday, the most important day in the Christian world. Without the resurrection of Jesus, Nothing would make sense for us who believe in Christ. All would be lost. We would have no hope for life, nothing to look forward to at the end of the day. This COVID-19 crisis that we are currently faced with is a real moment of opportunity to focus on life, on the things that give meaning to our existence. The journey of Holy Week leading to this day, the Pasqua, represented for most of us suffering, pain, isolation, social and physical distancing. And even on this day of the resurrection, we continue to persist in the struggle. But today's resurrection reminds us that life overcomes death. Light overcomes darkness. Hope shines in the threat of despair. And there is a reason to live. We will overcome, and we will get through this. I would like to invite to the podium Mr. Dion Webb, Dr. Dion Webb, the Deputy Labor Commissioner, to address us.
Good evening, everyone. The Department of Labor is pleased to be here today to update the general public on a few matters. The Labor Act, Chapter 1818 of the Laws of St. Christopher and Nevis states, the Labor Commissioner shall use his or her utmost endeavor to safeguard and promote the general welfare of workers of the state. During this crisis, the Department of Labor has taken this responsibility very seriously. I will speak now about the COVID-19 relief up to $1,000. This stimulus relief was announced on the 24th of March 2020 by the Honorable Prime Minister. It is a joint venture between the Department of Labor and Social Security. Who qualifies for such payment? Full-time and part-time employees who have been laid off, persons currently employed but with reduced hours, and their hours must take their wages below $1,000. Your position was made redundant as a result of the pandemic. And finally, registered self-employed persons whose income was impacted by the COVID-19 pandemic. Despite the challenges of the lockdown, our team at the Department of Labor has been working extremely hard to bring this relief to fruition. We have received to date approximately 2,000 applications via email, and we are in the process of verifying these applications. We understand the difficult times many households are going through at this moment with the loss of income. We are therefore asking everyone to be patient, do not panic. The Department of Labor, in conjunction with Social Security, will deliver this relief. We are encouraging all employers who are affected by the present pandemic to please send their information about their employees to the Department of Labor as soon as possible. The information we are seeking, the employees' banking information, their names, their wages, previous hours, proposed hours, and their Social Security number. You can send such information to deon.webb@gov.kn. Also, you can send that information to psrattan.lssea@gmail.com. We have worked closely with the Department of Labor in Nevis and Social Security in this effort to bring immediate relief to our people. Our objective is to provide meaningful support to all those who qualify who having lost earnings temporarily so they can be able to carry on their lives. Self-employed persons out there, you must contact Social Security directly. And you can do so by filling the form and sending the form to COVID-19fund@gmail.com. COVID-19fund@gmail.com. Every effort is being made to keep persons employed. We are working with this emergency and medical experts to guarantee health, safety, and welfare of all workers within St. Kitts and Nevis. As I stated earlier, we prefer to keep people employed, but our concern is the public health and safety of our workers. Let me repeat, we prefer to keep people employed, but our main priority is the health and safety of all workers within the Federation. We appreciate any effort by employers to give partial work to keep their properties in shape. I want everyone listening to always remember the Department of Labor is working in the best interests of the workers, which represent the most vulnerable group. My second point is persons who have outstanding severance and long service claims at the Department of Labor. The Department of Labor is monitoring the lockdown situation very carefully and is devising a plan to have employees work from home if it becomes necessary to complete these claims. Always remember the Department of Labor is working in the best interest of all workers. It is taking some time, but we have to always complete the process. It is a big undertaking at this time during this crisis situation. I would like to thank all staff at the Ministry and Department of Labor, more specifically our Senior Minister and Minister of Labor, the Honorable Vance Amory, our Permanent Secretary, Ms. Shawan Watan, Ms. Terrell Bass, Ms. Carleen McMahon, Ms. Desiree Taylor, Ms. Ashrick Archibald, Ms. Nivesia Scarborough, Ms. Grace Lawrence, Mr. Darren Richards, Mr. Gary Libod, the Chief Labor Officer on the island of Nevis, and his staff, Mr. Antonio Maynard, and the staff at Social Security. Thank you.
Thank you, Dr. Webb. I would now invite Superintendent Cromwell Henry, Divisional Commander for District A, to address us.
Thank you very much, Mr. Williams. A pleasant good afternoon to all those listening to this broadcast. Yesterday, I mentioned that following our management meeting, we observed and we discussed at that meeting the number of persons who were violating the terms of the curfew, the stay-in-place order in particular. And we have decided and had directed our men that we're going to take things to the next level and we would ramp up arrests. Over the last 24 hours, we have made 7 arrests for persons violating the curfew. And to date, we've had 55 persons being arrested, 32 persons charged for this offense, and the others reported for the offense. We again want to remind persons that we are under a 24 hours curfew, meaning that you are to stay within your residence unless you are coming out for a purpose that is recognized in law. Such purposes are for emergency medical attention, or if you are an essential worker, or if you are permitted or you are exempted by the Commissioner of Police. What we are also seeing is that those persons who are exempted for specific reasons are using their exemptions for other reasons. So for example, a person who is a security guard at a hotel in the night, he's being found on the road during the day, doing other things other than his work at the hotel, and he's producing that letter when he's stopped as his permission to be out. That will not work. We would recall those letters from those persons who abuse them, and those persons can find themselves being arrested. We are very lenient at the first time, but we are seeing too many of it happening, and we are again warning those persons who are essential workers or persons who have exemption letters that your exemption is only valid for the purpose stated in the letter or for your employment. You cannot use the letter to go to the beach. You cannot use the letter to make personal errands. And you cannot use the letter for entertainment. It is only for work-related purposes. Speaking of the beach is off limit. It is one of the social activity that is restricted. No person shall attend to any beach or be found on any beach at any time. You shall not have any private parties, even in your house, unless, of course, only family members who live in the house are attending that party. You shall not have any weddings, any banquets, balls, or receptions, or any other ceremony in any facility or public place. Funerals are also on the list of restricted activities. However, this new regulation made an exception for funerals to be held on partial curfew days. So persons who wish to bury their loved ones, you can do so on partial curfew days. However, you must make that request to the commissioner so that he's aware that a funeral will be taking place on that day. And there are some rules that goes along with that permission. I will just highlight them. No more than 10 members of the immediate family should be in attendance. So if you get permission to have your funeral on a partial curfew day, no more than 10 members of the immediate family shall be in attendance. And there shall be no more than one officiating pastor. So some funerals have 2 officiating pastors. For the purpose of this regulation, only 1 officiating pastor is permitted. Only essential mortuary personnel shall be in attendance. And the maximum period, the maximum duration of the funeral should not exceed 1 hour. And as usual, persons attending the funeral are required to adhere to the social distancing and the physical distancing protocols that is promulgated in this regulation. So you can have your funerals on partial curfew days, and the partial curfew days will be April 16th and 17th. Those are the next partial curfew days, April 16th and 17th. You can have your funerals on those days. You must apply to the commissioner, and you must follow these rules that I just outlined. All right. In closing, I want to say a special thanks to Mr. Ernest Amory of Amory Bakery, who made a generous donation of bread and pastries to the police yesterday. You know, last week Thursday, when the general public had the offer, the security forces, the police in particular, we did not benefit much because we were busy trying to maintain order at all these different sites. And so the police were basically left out. And he made good on his promise to ensure that everyone was supplied. And he went in specifically for that purpose, went into the bakery specifically for that purpose and supplied the police yesterday with bread and pastries. We want to say a special thank you to him for that. Again, I want to thank the majority of members of the public who are cooperating with the police. We get a lot of calls. We see it on Facebook a lot. People are reporting when they see things happening that should not be happening. They are calling and they are reporting instances where people are congregating, and we are responding appropriately. We want to ask you to continue letting us know when you see these things. We cannot be everywhere every time. So if you happen to see something happening in your area that should not be happening, call the police, inform us, and we'll be happy to respond to address. Thank you again for your cooperation, and we continue to urge your full support.
Thank you very much, Superintendent Henry. I now invite Dr. Marissa Carty from the Ministry of Health to give us our COVID-19 situation report.
Thank you, Mr. Williams, and a pleasant good evening to all listening. As of Sunday, 12th April at 3 p.m., the World Health Organization reports 1,696,588 confirmed cases of COVID-19 globally, with 105,952 deaths. In St. Kitts and Nevis, 216 persons have been tested, with 12 confirmed positive, 168 confirmed negative, and 36 results pending, with 0 deaths. There are currently 29 persons quarantined in a government facility, while 139 persons are quarantined at home. 12 persons remain in isolation. 523 persons have been released from quarantine to date. The Ministry of Health's strategy to achieve a positive outcome is to reduce the intensity of the outbreak and to slow down the increase in number of cases as much as possible. To accomplish this, we are engaged in early identification of cases, which includes isolation and appropriate management, and aggressive contact tracing and quarantine of contacts of cases. The ultimate goal of this strategy is to interrupt the transmission of the virus. Remember, each of us have our part to play in protecting ourselves and others from this disease. Continue to engage in the social distancing measures currently in place. Eat well and boost your immune system. Engage in effective hand washing practices. And finally, wear masks in public places. Adhering to these practices will see positive outcomes and win the fight against this invisible enemy. Please be reminded that our daily updates are shared via the Public National Information System, and you can also receive our national statistics and other COVID-19 related information on our official website, www.covid19.gov.kn. Thank you so much.
Thank you, Dr. Carty, for that situation report with respect to COVID-19. I now invite Mr. Abdia Samuel, who is chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
Thank you, Mr. Williams. Good afternoon to all radio listeners, those viewing via internet, television, and otherwise. Greetings, happy Sunday to you, and I hope you had a good day. Today, I bring the update from the National Emergency Operations Center, and I wish to acknowledge Mr. Atnil Heiliger of CAMPS for donating 100 hot lunches to the most vulnerable persons in our communities, and this was distributed via the Social Welfare Department. We have seen a lot of our citizens rise to the call of duty and support our national efforts. To date, we have seen that the 311 hotline has received a total of 68 calls. 68 calls. 911 has processed 57 calls. The National Emergency Operations Center, otherwise called the NEOC, has processed 11 calls on St. Kitts, and these calls are for 6 requesting permission to move about during the curfew, 2 were health-related, and 3 were persons seeking general information. Yesterday, we would have seen 58 American nationals being repatriated to the United States of America via San Juan. This activity is ongoing. For your information, any American citizens that are interested in these repatriation flights, please contact the Ministry of Foreign Affairs or the U.S. Embassy directly. We have received several calls where persons are interested in these flights, American citizens, and we are asked to send you to the Ministry of Foreign Affairs and also visit the website of the U.S. Embassy in Barbados or the United States. The Water Services Department regrettably advises that the Sadlers, Dietbe, and St. Paul's area would see disruption in their water system. They also advise that this inconvenience is due to some challenges that they are facing at this moment. So you are advised to be mindful, and we encourage you to take care of such precious resource that we need at this moment. Persons are reminded to continue practicing social distancing. It's very important. The task force would have met today as it regards the shopping challenges that we have seen, and we met today with the chamber. The discussions were very fruitful, and some recommendations will be going forward to the cabinet. Again, I want to appeal to all to continue to work with the security forces, and I want to appeal to all to adhere to the advisories that are being given by the Ministry of Health. It is important for us to understand that we are in a state of emergency. We are not under the regular norms that we have. Therefore, this is going to require some sacrifices from all of us. We are working 7 days a week to ensure that we provide you with the necessary safety nets as we endeavor to bring St. Kitts and Nevis back to a state of normalcy. This requires an all of society's approach to combating this invisible enemy. We cannot engage in anything that is going to contradict the hard work, the dedication, and the patriotism that we have seen from our citizens for the past few weeks. So I implore on you to support the security forces, support the national efforts, and let us avoid those embarrassing incidents that we are seeing on social media. We are all one family, and we are all speaking with one voice against this invisible enemy. We are at a war. We are at a war with a virus, and we are at a war with misinformation. Let us fight these battles and come out victorious. Again, I want to thank all for their cooperation, and I want to thank everybody for the prayers. So I look forward to coming before you tomorrow with more information. Thank you.
Mr. Samuel, thank you very much. We are now at the point of the question and answer segment. This first question is from a troubled voter. What about the elections? We have 4 weeks before the auto dissolution of Parliament. What authority will the Prime Minister have? After that, who will govern? The second question, can our Prime Minister provide clarification of the curfew, if it will be lifted on Thursday coming or next week, Saturday? Attorney General.
Good afternoon to everyone, and I hope everyone had a blessed Easter and enjoying it so far. The question, as I understand it, is what is to happen to our elections. And you would note, be aware, that the term of a government runs for 5 years. 5 years from the date of the sitting of the first Parliament. Parliament first sat on the 14th of May in 2015. And so when the 14th of May 2020 comes around, the Parliament automatically dissolves. This can be found in our Constitution. If you look at sections 46 to 48, this governs the proroguing of Parliament. The Constitution also states that there are some 90 days after that time that the elections should be called. So it gives constitutional underpinning to the calling of elections up to August the 10th, August the 14th of this year. But we are in a state of emergency. And what does that mean? It means that because of this global pandemic, it means that because we in St. Kitts and Nevis are threatened with the health of our citizens, we have asked His Excellency, the Governor General, to impose the suspension of certain of our rights to allow our public health officials to carry out this fight against this pandemic. And to date, we feel very proud that we have been able, for the most part, to restrain the explosion of this pandemic in St. Kitts and Nevis. Many of you would see on CNN and other news media, international news media, that in countries in the first world, the United States of America, countries in Europe, where there have been significant deaths from this pandemic. Every day we hear that there is an increase in the number of deaths, for instance, in the United States of America. The last count yesterday that I saw was more than 2,000 deaths for one day. It is a very, very serious matter. And so the state of emergency that was imposed in St. Kitts and Nevis is to have our country protect our citizens against that. When exactly does this come to an end? We do not know at this time. We depend on our professional medical experts to advise us as to how this is evolving and to make recommendations as to when we can relax and lift this state of emergency. But at this point, when just a day or two ago, we were still having confirmed cases being announced, when we have a number of persons in quarantine who have been tested and we await their results, we do not know exactly where this pandemic is. And it would be foolhardy, it would be silly for us to want to contemplate that we put our population at risk while there is a state of emergency, while there is the potential for our citizens to be affected, and for us, God forbid, to have a similar fate as what's happening in much more advanced countries than us, like the United States. It is too early for us to determine what we do. I will say that when His Excellency appointed or proclaimed a state of emergency some 15 days ago, he did so initially for 14 days. And yesterday, that state of emergency has been extended to this Saturday, 21 days after that proclamation. The Constitution allows us under Section 19 to have 21 days when Parliament is not sitting for there to be a state of emergency proclaimed. If it is that we have to extend it further, the Parliament must be called and there will be a resolution debated in the Parliament, and if passed, there will be an extension of the state of emergency. For how long? That will be informed by our medical state, the state of the health state of the country, advice from our medical professionals to see how long can be a best practice to get this under control, fully under control. It means that during the next couple of days, you will hear, on the advice of our medical fraternity, whether it is necessary to extend the state of emergency. You will hear that if that is so, that the Parliament must be called in an emergency setting. Normally, Parliament requires 7 days notice to be called, but we are in a state of emergency. It's an emergency situation, and under such conditions, Parliament can be called at short notice. When Parliament is called, a resolution debated will determine for how long, if necessary, a state of emergency will continue. I want to just mention one other thing at this point, if I may, and that is, under the Constitution, which is our supreme law, as I said, Section 19 of the Constitution, the Governor General proclaimed a state of emergency. And in our laws, Chapter 19.02 of our laws, there is the Emergency Powers Act, first brought into law in 1967. It has been amended twice since then. But this act gives the state certain powers under the Constitution. Under Section 5 of that act, it allows the Governor General to proclaim emergency powers regulations. And while we have a state of emergency going until Saturday, the 18th, Saturday coming, on this round, there have been a number of regulations that have been proclaimed, that have been published in the official gazette to give them the force of law. We have done so under Statutory Rules and Orders, SRO number 7, number 9, number 10, and currently SRO number 12. This last SRO goes until Saturday of this week, by which time we would determine what and for how long new regulations will be published. You will be informed as to how these will go forward. I should point out that all of this is being done for the protection of our citizens. Our Constitution gives us the power, that is the Governor General, if he is reasonably concerned about the national security, public order, and in our case, public health. We are being faced with a public health crisis, and it is on that basis that there is a state of emergency, that there are emergency powers regulations to regulate our behavior. We regulate the behavior by deeming it necessary to have our citizens shelter in place, to stay at home, and in some days, limited, restricted use of exit from your residence if you need necessities such as food and medicines. But we are all asked to shelter in place, to stay at home, so that our professionals, our health professionals, can adequately fight this scourge, this pestilence, this infectious disease that threatens us. And we appeal to all our citizens to abide by these regulations, to follow the instructions of the security forces, the police, and others who are putting themselves at risk, as well as our nurses and doctors. This is no time for us to be playing around. It is a very serious time. And we in St. Kitts and Nevis, we believe, have been very fortunate to date. We have had no serious cases in our hospitals. We have had no deaths. We empathize with our neighbors where they have had serious cases in their hospitals and where they have had deaths. But our professionals to date have been able to have us stay in a state of safety, and we hope this continues. So once again, I appeal for us to abide by that. I hope that answered the question. Basically, the state of emergency is in place. While there's a state of emergency and our people are threatened by this health crisis, the elections will have to be a back burner. Because how can you go to a poll when you can pick up corona and you can become hospitalized? When our medical professionals see that things have eased, that we're in a better place, we will be debating this and discussing this. Let the country know where we go next. Thank you very much.
Thank you, Attorney General, who is also chairman of the Disaster Mitigation Council. Thank you. These three questions are from Bucky Got It Media. What are the plans to get more people tested for the COVID-19? Can family members call via telephone, cell phone, to someone in government quarantine and isolation to check on their status? When would farmers' feed be discounted to $25 per bag? We keep on hearing it will happen, but can we be given a time frame? CMO, Dr. Laws, and then Director of Agriculture, Mr. James.
Good afternoon, everyone. I will attempt the first two questions. The first, what plans do we have to get more persons tested? At present, the Ministry of Health is in the process of testing all suspected cases. The Ministry of Health is guided by the World Health Organization's surveillance case definitions, and all suspected cases at present are being tested. In terms of can family members call government assigned facility and speak to someone in quarantine? And yes, once the individual has a mobile phone, anybody can make contact with such an individual. So the answer to that is yes. Thank you.
Mr. James, before you come, there are two more questions so that you don't have to come back. I'll ask them. Crop farmers were recently given 2 hours to visit their farms. When would they be allowed back on their farms to work? It's been almost 2 weeks. The Agriculture Department has been closed to crop farmers and land prep discontinued. How then are farmers going to produce if the land is not prepared to plant and farmers don't have access to pesticides to treat their plants? Mr. James.
Thank you for the question, and Easter Sunday greetings to all. And I trust that despite it being different, that the meaning has not in any way been diluted. I, for one, try to put on some multicolors. Very often, we say color has a way of instilling happiness and excitement. And, you know, it's as a way of helping to stay upbeat. As I was here, I was just trying to quickly scroll through so that I could actually read the minute that I received. But I'll just summarize it to say that the Honorable Minister, Mr. Hamilton, has given instructions that as of the 16th, April 16th, the stimulus package for the feed, being at half price, $25, will take place. So as of the next date that we'll be selling feed, the feed will be discounted at $25. I will, later in the week, be able to give you the exact date. As of now, I anticipate that date being Friday. Just anticipating, but as I do my briefings later in the week, I'll be able to tell you specifically. There is the continuous question about what happens with crop farming. That is a matter which is being constantly discussed by the Minister of Agriculture, the PS, and our leadership with the Commissioner of Police and those in authority. As the case is now, the general view is that generally we still must observe the restrictions and that we have limited time for farming. There are points on either side, for and against, but as is right now, that is the position. I look forward to the time when we could resume fully or nearly fully, certainly have a lot more liberties. Tomorrow, our extension staff will meet in a Zoom meeting where we'll be discussing the stimulus package, and we will be putting out our proposal to our crop farmers as to how we think we should go forward when we are given the green light. But we have to wait until we receive that authority. In terms of land prep, it means that for now the land prep continues to be severely restricted or on hold. But as it relates to supplies that we have at the department, I've taken the decision that we will reopen. Again, I more think that is Friday of this week, where farmers can purchase supplies. Because the limited time that the farmers have, the weeds are growing, monkeys are still invading, insect pests and so on are there. So obviously we need to take action. It's been about 3 weeks, and so we will try to make the supplies that we have available. I ask for your patience. I ask for your understanding. We believe that it is for the greater good, and that once we get through this, then it would be full speed ahead. I know all farmers don't 100% agree with it. They have lots of different opinions, and I know we are constrained in some ways because, for example, our agriculture is weather dependent, and the further we go into the year, the drier it gets until towards the end of the year, and it makes it more difficult to farm. I believe the commissioner understands this, but we are dealing with a greater problem, and so we are asked to understand. I do trust that, difficult as is, that we'll see the greater picture, the bigger good, and cooperate as much as we can. Thank you.
This question is for Superintendent Henry. Are there any restrictions on taxi operators for filling the void left by bus drivers on the reduced curfew days, instead of them congregating in the circus, not practicing social distancing? And this one is for I don't know if it's for the CMO, but the CMO has encouraged persons to shop healthy. However, when one goes to the stores, no fruits are available because the containers were not offloaded. Is it possible for the supermarkets to get permission to restock prior to the opening day for shopping? And then this one is for Mr. Samuel. With the hurricane season fast approaching, how stretched would NEMA be in dealing with this current pandemic? Or what may be a very active hurricane season, or even worse, both pandemic and hurricane season?
Yeah, Mr. Williams, thank you for the question, and thank you for the question, whoever asked it. As it regards to the person asking about the supermarket restocking, that process is already ongoing. The Commissioner of Police already gave permissions, and we have some of the supermarkets already restocking as we speak. So that is already ongoing. As it regards to the hurricane season, we are aware of the hurricane season, and we are going to rely heavily on our 10 national subcommittees. We have a number of subcommittees that are working remotely, and we are going to begin those prepared. Actually, we have already begun the preparedness measures. For example, the Housing and Shelter Subcommittee already have done most of the inspections. Our hurricane emergency shelters, are already be identified, and they will be going to cabinet for approval. And the other processes already have begun. I think the health sector is doing a good job in managing the pandemic, and if necessary, everything will be integrated into the response that we have going. If impacted, then we will have some of our regional partners like CDMO assist us. We also have USAID OFDA who have said that they are ready to respond if necessary. However, you know that our borders are closed. And if our borders are closed, that means that you, the citizen, will have a great role to play in determining how we respond, how we manage, and how we recover from any impact of any hurricanes on St. Kitts and Nevis. Also, I want to just remind you, the outcome of how quickly we address this pandemic is dependent on you, the citizen, doing your part.
With respect to the question about the taxis hanging around in the circus, not practicing social distance etiquette, I really hope that they discontinue that practice. Whether you have anything to do or not, you should not be congregating in any close groups within the 6 feet that is recommended. With respect to the taxis now substituting for the H buses, the Ministry of Transport is currently considering proposals to deal with public transport, and so I'm certain that an announcement will be made once those proposals are finalized, and we will know the way forward with respect to public transport in general.
This question is from Freedom FM. In light of Nevis launching their health app, Nevis Health, will St. Kitts launch one similar and use it to track patients, as the health authorities are unable to guarantee that quarantined patients stay at home, as stated by Mr. De Silva? Who's going to take that? Will anyone take that question? No. Okay. This question is from SKN Newsline. It is my understanding that there will be a CARICOM meeting on Wednesday, 15 April. What new initiatives will be discussed? Question number 2. Could someone indicate whether the 12th COVID-19 case is from St. Kitts or Nevis? And with the time frames involved, is that person close to recovery? CMO laws.
As announced a few days ago, our 12th case resides in St. Kitts, and that case is associated or connected to a previously announced case. It's a contact. The 12th case is actually a contact of a previously announced case. In terms of the upcoming CARICOM meeting, I am not aware of the agenda, and so as yet, and so I cannot comment with respect to new initiatives. I'm not sure if Minister Phipps wants to add anything with regards to the upcoming CARICOM meeting. Thank you.
Okay, Mr. Williams, thanks for the question about the app. We have been in consultation with the Ministry of Technology, and we have been looking at a number of models as it regards to an app. And if we launch this app will be a national app because this is a federation. So the app will look into many things. As it regards the tracking process, we are actually using our effective tool that has been working, and that is our quarantine and isolation task force. It has been working very well. We have seen compliance at a high degree, and I want to reassure the general public that most persons are now staying in their shelters as it regards quarantining and isolation. But we are in the process of looking at an app that is holistic to all in the Federation.
This question is from WinFM. With a number of companies locally producing face masks, is there any oversight to see if they attain the standards prescribed? And the second question, what measures are in place for the differently abled to carry out their shopping?
As it regards to the mask, I think a few days ago, Dr. Cameron Wilkinson would have made a reference to these masks. And also, if we go back again also, Dr. Laws herself would have spoken to these masks. Some of these persons would have consulted Dr. Laws, in which she approved of the masks. So we are hoping that persons will continue to exercise such practices. Also, as it regards to the second question, that's right? The differently able. We are hoping that persons, supermarkets, and also our general population, when we see our differently able, they will exercise some sort of humanity and allow them to pass. But they are categorized in the area of persons with the elderly, that line that was set up for the elderly and so on. We are hoping that they are given the opportunity to access shopping during that time as well. Thank you.
This question is for Superintendent Henry. 10 family members are allowed to attend the funeral, as stated. Does that also include the pallbearers?
My interpretation of the regulation, and the AG could correct me, is that 10 persons are permitted at the funeral, plus the officiating minister, the funeral staff, and other persons involved in the burial. But 10 persons attending the funeral. So whether they are pallbearers, family members, or friends, should not be more than 10.
This is from a concerned citizen. I am a business owner and have written to the Commissioner of Police several times requesting permission to check on my properties, feed my dogs, and reset my alarm every 2 days, all of which only takes about an hour. When the Commissioner finally replied, it was in one sentence saying, request denied. There was no reason given, no offer of assistance or advice to my request. What is a man supposed to do in this situation? This question is from Sugar City FM 90.3 for Superintendent Henry. Superintendent Henry, many of us saw a display of a video and words of a mother pleading about the alleged abuse of her son by 2 police officers at Prickle Pear Alley. All of this may be under investigation at this time by the Royal St. Christopher and Nevis Police Force, and no one can judge the circumstances. Has any resolution come out of this as yet? And were any charges laid against the young man? Could you kindly read to us the COVID-19 regulation that covers the curfew and boundary restrictions for more clarity? Second question from Sugar City FM 90.3. Hardware stores in Barbados have been assigned opening hours to allow persons to get much needed supplies. Will the government of St. Kitts and Nevis do likewise? And the third question from Sugar City FM. Good day. I would like to get some clarification on the difference between social distancing and physical distancing. I realize the 2 terms are being used somewhat interchangeably. Is there any difference?
Now, if I may address the question from Sugar City Rock, I think the writer partly answered the question. If a report was made, that report is under investigation, and I'm certain that a resolution would come once the matter would have been adjudicated either internally or in a court of law. So I cannot speak to any allegation that is made against the police at this point. Just to say that any allegation that is made, we have a process of investigation and resolution for these matters. So the process would have to take its course. With respect to what the law says about sheltering in place, the Section 8 of the regulation, it says, subject to Subregulation 2 and Subregulation 16, in an effort to prevent the spread of the novel coronavirus, or COVID-19, every person shall remain confined to their place of residence. And this is important because I've been having questions even earlier today, whether you should stay indoors or stay at your residence. There's a difference. Stay indoors could mean stay at your family's residence or stay at a friend's residence. It must be at your residence. So you cannot go over by a friend. You must be confined to your place of residence, inclusive of your yard space, to avoid contact outside of your family. Except, of course, if you are an essential worker who are required to report for work, and this part is important. If you are an essential worker who are required to report for work. So if you are an essential worker and you're not required to report for work, you should stay at your residence. Or workers required to work under Regulation 6. And Regulation 6 speaks to hospitals, business license to provide private security services, and other businesses or undertakings that are exempted by the Commissioner of Police. And thirdly, for essential travel for medical emergencies. So there are 3 exceptions to this shelter-in-place rule. Essential workers who are required for work, workers who are required for work under Regulation 6, that is, medical persons and private security guards, and for essential travel for a medical emergencies. Thanks.
Okay, I want to address the question of restocking, because yes, we have the big supermarkets restocking. However, we also want to encourage the rural supermarkets and business shops, the shops as well, to write to the Commissioner of Police, as the other supermarkets did. And I am certain that the Commissioner of Police would do his best to facilitate you. And that would include also if you need to go to come to the city, to Bastia, by the suppliers and get your stock so that you can be restocked. All it takes is for you to contact in the office of the Commissioner of Police, as we have said previously, and the Commissioner of Police will use his judgment and give the necessary permission as required. Once you do that, I think you may be facilitated. And we encourage that because we want everybody to be stocked up and have the products so that you can actually be able to serve the persons in the community. That question was asked to me earlier, and I engaged the Chamber of Industry and Commerce, and they responded today in the positive and told me that the suppliers are ready to supply the rural shops and the rural supermarkets so that they can be ready for the upcoming shopping days.
All right, so we are thankful for the question regarding social distancing versus physical distancing. Now, social distancing refers to the practice of maintaining a greater than usual physical distance between yourself and other individuals, or in other words, avoiding direct contact with other persons. And in the case of our fighting this pandemic, it is recommended that you maintain a physical distance of 6 feet between yourselves and other individuals. Now, these two terms, social distancing and physical distancing, have been used interchangeably. But I think up to last week, the experts have said that the term physical distancing is more apt, and it's the preferred term. Physical distancing over social distancing. Thank you.
We're just going to take 3 more questions, and then we would end the question and answer segment for this briefing. These questions are from a bus driver. It will all be seen as one. Can you? Right. The question is asking for someone to expound on how passenger bus drivers and small pharmacies are covered or can benefit from the stimulus package. This one is from SKN Newsline. From a medical standpoint, what is the most pressing concern at this time? And this one is from a concerned citizen. There are self-employed persons with the concern that they have backdated Social Security filings to be made. As much as we should be up to date, is there any period of time that payments can be made up to date in order to apply for the self-employed Social Security package, such as no more than 6 months behind due? Many consider themselves already disqualified.
I want to thank you for those important questions. let us go to who qualifies for the up to $1,000 COVID-19 relief. Full-time and part-time employees who have been laid off. Employed, but your employer now place you on reduced hours, and your reduced hours take you below $1,000 a month. Your position was made redundant as a result of the pandemic, and registered self-employed persons whose income is impacted by the COVID-19 pandemic. So all self-employed persons out there, whether you are a bus driver, whether you are a farmer, whether you work you own a pharmacy, once you are self-employed and you are registered, please to call 667-2535. 667-2535. Do not disqualify yourself, or do not let anyone tell you that you are disqualified. Allow Social Security to determine that. If you have outstanding contributions, Social Security will be willing to speak with you and see what can be done to assist you during this special period of time. Okay, so the number again is 667-2535, and it is for registered self-employed persons whose income was impacted by the COVID-19 pandemic.
All right, so Mr. Williams, I'm having a little challenge in terms of interpreting that last question. What is the most pressing thing for the Ministry of Health at this time? Well, the most pressing concern for the Ministry of Health at this time is for us to aggressively control the COVID-19 outbreak such that our health system is not overwhelmed, and ultimately we want to preserve the lives of our people. Now, if you are asking what is the most pressing need of the health system at this time, that's a totally different question. We are in need of personal protective equipment. We have in store, we have on order, but we cannot have too much of this. And so that's a very real need for the Ministry of Health at this time. So if anybody wants to donate, you can feel free in donating personal protective gear for the frontline health workers. Thank you.
That brings us to the end of our questions for today. I want to thank you very much for your questions and thank all the persons who attempted and answered your questions. That is why we are here each day for this daily briefing. Thank you very much to all our presenters for today. We thank Mr. Dion Webb, who is the Deputy Labor Commissioner. We thank Dr. Marissa Carty. We thank Superintendent Cromwell Henry. We also thank Mr. Abdias Samuel. And we thank all those persons who answered. Director of Agriculture, Mr. Melvin James, our Attorney General and Chairman of the Disaster Mitigation Council. We also thank Chief Medical Officer, Dr. Hazel Laws, and of course we recognize with us, as usual, the Honorable Wendy Phipps, Minister of State with responsibility for health. Tomorrow we will be back for another daily briefing, and we continue to remember that this is the day that the Lord has made. We will rejoice and be glad in it. It is the day of resurrection. Thank you, and see you tomorrow at 5.